Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast. My name is Sully, and I'm here with Will, Gordon, Ben, and LaShawn.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
The opioid crisis is still going as we speak, and the COVID-19 pandemic has only made it worse. News articles from all over Canada have discussed how public health measures taken against the pandemic have consequently hindered other measures, such as supervised consumption sites, which are crucial in the fight against the opioid crisis. Until recently, these sites were running at reduced capacity, thereby decreasing access to this service, which has been associated with increased overdose-related deaths. So, what are supervised consumption sites and what are their goals?
So, supervised consumption sites, or SCS, are provided in legally sanctioned facilities, and they basically allow individuals to consume pre-obtained drugs under the supervision of trained staff and are designed to reduce the health risks often associated with drug consumption. So, for example, overdose or maybe secondary illicit drugs that are more toxic, like fentanyl, within the pre-obtained drugs.
Yeah, and in addition to that, these supervised consumption sites often include sterile supplies, education on safer consumption, and like Ben mentioned, overdose prevention, whether they're using a naloxone. They also have a bunch of services that they can refer individuals to, such as things related to treatment, housing, income, support, and other services.
In addition to safe consumption sites, speaking from my personal experience, in 2015, when I worked as a pharmacy assistant, that was kind of the first time I was made aware of harm reduction. And the particular harm reduction strategy in that case was the needle exchange program. So what we did is we had a public health nurse, I believe, from the health unit, and she basically gave us a bunch of kits where it had like clean syringes and like other supplies that are helpful, like alcohol swabs and a tourniquet in order to catch your veins properly. And essentially the purpose of these needle exchange programs is to ensure that people who use IV drugs or intravenous drugs can safely inject them into their body without kind of damaging their skin or their body, and ensuring that they're using a clean needle that's not contaminated with HIV or hepatitis. So that was the first time I learned about harm reduction and safe needle exchange programs. What these supervised consumption sites do, though, is they take this up a notch, and instead of just handing a kit to someone who uses intravenous drugs, essentially they provide like a safe space as well as trained staff to essentially help people to inject drugs safely and to help with any unintended consequences of using drugs such as overdoses.
I had a question regarding safe consumption sites. So if an individual who is accessing this service was to bring in their pre-obtained drugs, are there rules or regulations, policies in place to test these drugs to ensure that maybe they're not laced with something like fentanyl or carfentanil that might increase the risk of the individual using them at the facilities?
Yeah, that's a good point, Will, because we discussed in our opioid episode that drugs being laced with fentanyl or other synthetic opioids was basically the number one cause of opioid-related overdoses, right? So given that it's a harm reduction strategy, science has been able to develop certain kind of test strips to test and detect fentanyl in drug supplies. I'm not sure then what happens after if someone, the pre-obtained drugs that someone comes in with, if that tests positive for fentanyl. I'm not sure if whoever the trained person on site would just kind of, maybe tell them to use less or something like that. I'm not sure what the policy is after something tests positive, but there are some safe consumption sites that use fentanyl test strips to test drug supplies.
Do they contain like a safe supply of drugs at some of these supervised consumption sites? No. Okay. Because I know that's what they're trying to do now, isn't it? Anyways, we'll get there.
Yeah. I know maybe as a pre kind of step to that, they do have, there's some places that have prescription heroin, where right. So they're able to, and also in that opioid episode, Will was talking about the pharmaceutical industry might be able to play a role because they can kind of ensure the quality and safety of drugs, and that's kind of one of the purposes of having the prescription heroin, but it's not a best practice yet.
Yeah,
sure.
That'd be extremely controversial, bringing in the pharmaceutical industry to like test the safety of these drugs when they started the whole problem in the first place, right?
Right. That is true.
Yeah, not only test it, produce it.
Yeah, but guess what though? They are involved, right? Who makes the naloxone kits?
It's true.
Right? Who makes Narcan, right? And then who makes the Suboxone and buprenorphine? The pharma industry. So they are already, if it's, I know Purdue Pharma was a big one, but pharmaceutical companies are, unfortunately profiting from the opioid epidemic.
I know right now we're talking in the context of Canada, but are there any other countries who have implemented the supervised consumption sites? I mean, I know the first legally sanctioned one was in Bern, Switzerland.
Yeah, and then on top of that, there are 120 currently operating in countries around the world. And on top of Switzerland, there's Canada, obviously, Australia, Denmark, France, Germany, Luxembourg, the Netherlands, Norway, and Spain.
But where's the U.S.?
Yeah, I noticed you didn't mention the U.S. there.
Well, because what is the current situation in the U.S. is that there are currently none due to legal and ideological obstacles. And there have been talks about opening a few safe consumption sites, but the plans are continuously being delayed, obviously because of those aforementioned barriers, but also of COVID as well.
Just to add to Ben's point, there are no legally sanctioned operating safe consumption sites in the United States. There are, however, there's some programs that have been approved to start. I know specifically in, I think, Philadelphia this year in February, they were given the green light by the courts because there was an appeal pending, and they announced that they were gonna open in, I think, February or March, before obviously before the pandemic kind of came in full force. And then there was a huge protest, I believe, so they kind of delayed their plans to start. So even though I would say in general the United States is not a very quote-unquote illegal drug-friendly country, because they, when we refer to things like the war on drugs, you immediately think of the U.S. involved either as, upstream or downstream. So there's a lot of barriers politically in terms of running, approving, and operating safe consumption sites in the U.S.
And that's actually really interesting because even in Canada, the first supervised injection facility was Insight, which initially was a Vancouver-based NGO called the Portland Hotel Society. And they started off as a discrete facility that used this vacant-looking building to avoid that kind of public resistance that they might be experiencing right now in the U.S.
Yeah, and I think another part of the U.S. too, with drugs being politicized, it's also criminalized, right? So you think of even, I'm not sure what the laws are there for specific for those safe consumption sites that are pending approval, because I do believe the U.S. District Attorney was saying that kind of any state that implemented safe consumption sites, they would kind of throw the federal arm of the law on them. So people who innocently work at these sites, right, to kind of help people to prevent drug overdoses, they would also be liable to certain charges, right? So you think of all those roadblocks, and it's almost, given the climate there, it's pretty impossible to kind of have a safe consumption site working safely, if I could say that.
Yeah, but here's the thing, though. You mentioned that drugs is criminalized in the U.S., but however, in Canada is still criminalized. But the distinguishing factor here is that we have legally sanctioned supervised consumption sites. So not allowing for supervised consumption sites to open in the U.S. because, the whole war on drugs mentality and the legal barriers, that wasn't an excuse in Canada.
Yeah, but keep in mind, Sal, there have been at least one that I know of that has been legally allowed to operate. And despite being legally allowed to operate, they're not operating. Yeah. So it speaks more, beyond, just political or politics, I should say. It's the kind of the general ideology within the general public that's very resistant to the whole, even back in the day, I don't know if you guys know of this term, enabling. You'd watch shows like Intervention on A&E, and it's like, enabling is about don't enable to use drugs, and I think that still prevails there, right? Anything that's not abstinence based or treatment based in the US is kind of forbidden. So I think even when it's illegal, you have a lot of opposition to it.
Yeah, so I mean, now we're talking about, well, basically barriers to adopting supervised consumption sites. So what are the fundamental barriers to it?
Yeah, I think one of the ones that I hear often, at least, is that having supervised consumption sites in certain communities will cause an increase in drug use or injection use, and you really allow more people to use drugs.
Yeah, so as I mentioned before, so you have the legal obstacles that we were debating about, Sully, and then once you get past the legal obstacles, you get the ideological obstacles where, people or communities or cities, the people living in those communities are vehemently opposed to kind of those kinds of harm reduction strategies. Like, just the concept. I mean, I have to be honest with you too. Like, referring back to that example of when I learned about needle exchange programs, even in the general sentiment with my coworkers too is like, wait, we're giving people needles to use drugs?
Mm-hmm.
It didn't feel right to me. I had to go home and like really think about, because as I said, growing up, drugs are bad. We shouldn't enable them. And then we're going to give someone a clean needle so it was a very hard conflict that I had to overcome. And, I think that the basic premise, and to go back to the harm reduction principles in our last episode, is to focus on the harms associated with addictive drug use. We have to understand that addiction in of itself is a disease, just like cardiovascular disease and other types of diseases. And we have to, the approach is different. The difference with, substance use diseases and other diseases is that the disease is that it's a use of a substance.
Yeah.
You have to get people to use that substance safely, right? So I don't like to draw examples in this way, but if you think of something like hypertension, a lot of hypertension is associated with a high intake of sodium, right? So a harm reduction approach for hypertension in that case is to help people maybe eat salty foods safely and cut down on their salt intake. So you might want to drink more water, exercise, right? So in that way, there's some kind of parallel overlap in that you want to minimize the risk associated with whatever it is that you're doing. So I wanted to emphasize that.
I understand the parallel, but I think just to play devil's advocate, there's more complex factors in relation to drug or substance use.
Yes,
is because
definitely,
obviously you have the crime and violence aspect of this as well, which people are afraid of bringing into their community.
Right.
So I think decriminalization obviously has been shown to work with more softer substances, aka cannabis. But I personally don't know the answer of whether it would work for more harder substances such as heroin, etc. But if it helps get rid of this whole not in my backyard mentality, then I think it's an avenue worth investigating with obviously evidence and whatnot.
Yeah, and I think you're talking about the decriminalization aspect, and I think the obvious thing that comes to mind is what's happening in Portugal. So in the 1990s, Portugal was really facing a huge issues with heroin use and obtaining illegal drugs from different drug markets. So in 2001, the Portugal government actually decriminalized the possession and use of illicit drugs as kind of a further act to commit to harm reduction strategies.
But what I want to make clear, though, is that having supervised consumption sites doesn't mean you should legalize the use of drugs. That needs to be a clear distinction there.
Before we move on, though, so to add to LaShawn's point, by decriminalizing the possession of illicit drugs for personal use, because I believe that's what the specific law is. It's not legal to to kind of sell drugs. That's not what decriminalization means. It just means that you won't be criminalized for the possession or use of drugs for your own personal supply. The key thing with that is they did notice a huge drop over time in their opioid overdose related deaths. So there is, I would say, the evidence for decriminalization, based on the levels of evidence that we look at in public health, is actually stronger than safe consumption sites. So with that being said, what are some of the evidence around safe consumption sites that we have today in order to address the opioid related overdoses and deaths?
So what we've found from the literature, and these are over 100, I think, evidence-based peer-reviewed studies, is they've consistently proven the following positives of these sites, which is that it increases the entry into substance use disorder treatment, obviously, if you have these networks affiliated with these sites. It reduces the amount and frequency that clients use drugs independently by themselves if they're at home and like not in a safe environment.
The evidence also shows that supervised consumption sites have reduced the risk of HIV and hepatitis C, and they've also successfully managed on-site overdoses and reduced drug-related overdose deaths.
For me, when I'm thinking about these studies, when I looked into some of the literature, I think Gordon and I had a discussion about this earlier. We're seeing that, especially a lot of the evidence coming out of Canada with the Insight Safe Injection Facility or Supervised Consumption Site, most of the studies that were done were observational, as opposed to your kind of clinical trials and randomized control studies.
Yeah, I think the key here goes back to when we're saying safe consumption sites or evidence-based, we don't really necessarily talk about the quality of these studies, right? We don't talk about the kind of sample sizes of these studies. We don't talk about the context of these studies. Studies from Switzerland, are those findings reproducible in Canada and vice versa? So are we homogenizing the populations across countries that use intravenous drugs, right? There's a danger in kind of taking something and scaling it to a different setting, and we don't really analyze the nuances with the different populations. We don't know what, is access to healthcare a factor in determining the success of these safe consumption sites? Is stigma a factor as well from the general public? So I wouldn't say necessarily the jury is out on safe consumption sites, but what I would say is there are also a lot of barriers in terms of why we don't have answers to these questions. Safe consumption sites, as we've discussed in, a lot of research that we use in public health typically comes from the United States. And in the United States, it is not legal to operate any safe consumption facilities, right? So the evidence is lacking, maybe no fault of any one person or organization, but there's still a lot of work to do to kind of justify and even optimize the way safe consumption sites work. So with that said, a lot of times policymakers and decision makers, right? If you can't make the argument for why a life is important, and that's very sad that sometimes that's not good enough, right? That,
True.
Lives are important, so do X, Y, and Z. We also have to understand that in the world we live in, there are limited resources available to kind of do interventions in public health work. So as far as what we know now, what are the economic arguments in favor of harm reduction programs such as safe consumption sites?
Right. So they did one analysis that was conducted in San Francisco, and it estimated that for each dollar spent on these sites, roughly $2.33 US would be saved in emergency, medical, law enforcement, and other costs, which yields in total a savings of $3.5 million per year. And then another report from the Johns Hopkins Bloomberg School of Public Health found that opening just one of these facilities in Baltimore would save the city $6 million annually in relation to those costs. So it's interesting that everything is, in regards to an economic evaluation, is in favor of these sites, which is directly in contrast with the whole not in my backyard mentality of what a taxpayer may say, in the sense of, why am I paying as a taxpayer for people to do drugs?
I would say, to be honest with you, I think we need to... one of the problems I think with public health too is even though it is our duty when we do feel like we have good evidence, to try and go on a campaign to convince people to maybe change their perspective. A lot of times these people don't have the information that we have. And the reason I'm saying this is because if you're a family, and maybe family of 4 and you have 2 young children, and you like a house in a community where there's a safe consumption site maybe 1 kilometer away, and then there's another community where you like the house and there's no safe consumption site, and you like the houses equally well, you might be more inclined to choose the neighborhood without the safe consumption site, not knowing that the presence of safe consumption sites do not bring more crime to the area, right? So I think it's our duty also as public health practitioners to kind of engage in these discussions and provide the relevant stakeholders, such as people in the community, with information that they need in order to come on board with these initiatives. Because the very thing that public health doesn't like, which is othering people, public health often others people because it goes back to our misinformation episode. If the misinformation campaigns and disinformation campaigns are louder than the actual correct information campaigns, what choice do people have to believe but those information that they're getting, right? So I think it's just a duty for us to kind of, let's just have some of those discussions. You can't convince everybody, right? I acknowledge that, but there are people who can be convinced who we aren't convincing.
So the point I wanted to add related to the economic side of things, with the whole not in my backyard mentality, because of the lack of information and understanding of what safe consumption sites are, and also like that realization that they don't actually bring additional crime and also other sorts of factors. I think as we know, the housing market, as with any other market, is driven by supply and demand, right? And if most of public discourse is around the crime aspect, I would assume that houses in like the closer vicinities to these sites would significantly drop in value, and that has nothing to do with it, whether it's true or not. It's perception, right?
Yep.
Perception is reality.
Exactly. Yeah. And so, given that, I think, for example, if I was living in the neighborhood, it's not even a matter of whether I support these sites or not. It's a matter of these sites are causing my the valuation on my house, on my home, to decrease. So I can fully support this, but on the other hand, I need to also consider my own cost of living and everything that's related to that. So
yeah, and that's exactly right. Which is why it goes back to, I think all stakeholders need to be involved in this process. I think when you start imposing people and kind of creating divides, you have problems such as you have those perceptions that can lead to the housing, houses and communities losing their value because people perceive it to be a kind of a less desirable area. So if we don't get people involved, that's a reality that's going to happen, right? So what are the we talked about Baltimore, the business case for consumption sites in Baltimore, and we talked about in San Francisco the economic arguments. But what about Canada? Are there any evaluation studies or economic evaluations to make the case for consumption sites in Canada?
Yeah, one study actually of, not surprisingly, Insight, it found that the societal benefit that can be attributable to Insight was roughly around $6 million a year, comparable to Ben's number, I think, in Baltimore. Yeah, and then another cost-effective study also showed that the associated savings from supervised consumption site actually exceeded the cost of the facility actually operating.
So yeah, and at the end of the day, because we always want to go back to, you can't really put a price on the life of a human, especially if it's a loved one of yours. The data does show that, if I'm not mistaken, around the safe consumption sites around the world, there have been no opioid overdose related deaths that have been recorded as a result. So even if you look at it purely from public health's goal is to prevent premature mortality, safe consumption sites seem to be doing that. When people use substances alone, there's a greater likelihood that they will have an overdose and die. So I just wanted to point that out as well.
Yeah, and you bring the fact that these supervised consumption sites you're not alone. You're always being supervised just in case. But there's a whole other dynamic when you consider COVID-19 and the pandemic that's ongoing and its relation to these supervised consumption sites. I think there's a lot of hurdles that come to mind.
Yeah, especially when you consider how the pandemic has, disrupted our daily lives and, physical distancing and social distancing, which kind of goes against the very fabric of and the principles of a safe consumption site, where it's kind of a non-judgmental, non-stigmatizing community in which you can use drugs safely. And if the capacity of these are diminished significantly, and there's all these barriers to kind of use these sites, then you might have more people using alone. So what are some other ways in which these consumption sites were disrupted during the pandemic, especially in the context of Canada?
A simple one is increased waiting times. And that's, because of social distancing rules. And so you have less staff involved in these sites. You have less people willing to go outside and let alone go to supervised consumption sites.
Right.
And then you have the lineups, which, if you want to respect the 2-meter rule between person to person. All these pile up to increased waiting times, which means it's undesirable for people who use drugs to go to these sites in the first place.
So all these factors we mentioned served as barriers for people to access safe consumption facilities and safe consumption sites in a timely manner. But has this led to a change in the number of opioid-related overdoses and deaths that we're seeing?
Yeah, I mean, just looking at the city of Toronto, for example, it was reported that paramedics responded to 25 suspected opioid overdose deaths in April, which was actually the highest number since September 2017. And we see in different jurisdictions that the number of opioid or calls for opioid overdoses are increasing.
So do you think then, is this a result of more people using drugs, or that there's less access to these safe consumption sites?
It could probably be both, right? This pandemic, the restrictions that are being in place is causing individuals to be more lonely and isolated. And as a result, as you mentioned earlier, Gordon, individuals may be taking these drugs alone and in an unsupervised fashion. So it resulted in a lot of deaths in Toronto.
Another aspect that COVID has made worse regarding this whole situation, made it a lot more complicated, is the community backlash to these safe consumption sites. So for example, the supervised consumption site in downtown Toronto has gotten a lot of backlash from the community recently in the past few months, because the situation has gotten a lot worse in regards to needles, a homeless population, substance users, defecation on the streets, where the community is they've been saying across multiple social media boards that, it's only gotten worse these past few months and it's all because of this safe consumption site. But there isn't any recognition of the fact that because of COVID and all of these restrictions, that it probably has become worse due to COVID. So it's kind of ironic that these sites which have been shown to improve these aspects of the community have only gotten worse because of COVID. So it just kind of complicates the discussion in the future of going against those individuals who are not in my backyard. And then when you say, well, the evidence shows this, they would be like, well, look at the COVID evidence, or they would argue against it more. So I'm curious how these sites are going to function in the future, especially if there's more community backlash.
That's a great point. Another point that I found interesting was that a lot of the staff that are present at these supervised consumption sites now, as a result of many of the COVID-19 protocols and restrictions that were placed forward, they're often seen in masks and gowns. And I think, this might really act as a barrier for a lot of individuals trying to seek out help at these facilities, because there's also the stigmatization that these people are doing something wrong and, they're consuming drugs at this site. But a lot of what supervised consumption sites are based on is relationship building. And if there's that physical barrier in place, I think it really limits that sort of interaction and that kind of face-to-face interactions and relationship building aspect of harm reduction and supervised consumption sites in general.
Yeah, so kind of what you're saying is you show up to the supervised consumption site and you're going to, utilize the facility, and then you have all these people wearing masks, and you might think, wow, do they think I'm dirty? Like, am I, what's going on? Even though I'm sure they're aware of the ongoing pandemic, it kind of reinforces in their head the stigma that they already feel from society. And then that gets in the way of the effectiveness of these sites.
Right. And are they even going to want to go to these facilities if that's the case, right?
Right.
So it could act as a barrier.
Right. And then I'm sure too, even with all the changes when you get down to the nitty gritty, all the changes in the protocols, right? Not just the masks and PPE, just like, oh, well, sorry, we can't do that anymore because of COVID-19. These are the new rules during COVID-19, and people might just feel a little bit frustrated with it. So, yeah.
And even the fact that, you just don't want to go outside because you don't want to potentially get COVID-19, right? So maybe individuals are just looking to limit their interactions with others and going outside. So it just goes to show the dynamic between the two epidemics or two public health issues that are kind of compounding each other: the opioid problem and the substance use public health side of things, and the pandemic sides, and how they overlap.
The double burden of social distancing. Yeah. So in the short term, so even though we've been discussing that social or physical distancing protocols have kind of changed the experience for people using these supervised consumption sites, we do recognize that they are in place to protect the health and safety of those working at the facility as well as those utilizing the facility, right? So we have to emphasize that as well. There are unintended negative consequences like we discussed. However, those measures are put in place to limit the spread of COVID-19. So in the meantime, being the innovative society that we are, there are certain things that have been implemented. There are other technologies that have been put in place to kind of help people or supervise people when they're using substances. And I know there's a lot of pilot projects that are being implemented in the virtual or phone-based sense where a trained specialist can witness people using drugs. And I guess they would be able to, if I don't know, if the person's unresponsive, they're able to then mobilize resources like 911 to come to their aid. But I'm also wondering then if homeless people, for example, are disproportionate users of substances. I'm not sure they would have access to internet and stuff for like a Zoom. I'm not sure what technologies used, but this might not be equitable. But that's might be a whole other conversation.
A lot of what's going on with supervised consumption sites is that they often come in different forms. You got the standard form where there's a building, there's a physical location that's always present, but there's also the options of having mobile supervised consumption sites. And I know that's usually implemented in some jurisdictions to kind of deal with that situation or scenario, but I'm not sure about if these are being currently used given the pandemic.
One point I want to add is I would caution against scaling back physical distancing rules because I think that with the amount of community backlash often faced by these facilities and services, if you were to, give them an exemption and say, for example, the 6 feet distancing rule between people, can be cut down when people are accessing these sites. But we understand that it's, you're reducing these restrictions in order for more people to access these services and, potentially save more lives. But from the perspective of the greater community, I can understand that if they get angry and see this as another step of like weakening the rules that these facilities have to abide by. And I think, with the amount of backlash that they already face, I don't think I think there needs to be a lot of thought before something like this is considered.
Yeah, that's a good point. And then at the end of the day, in addition to opioid overdose related deaths, COVID-19 is also a real health risk, especially for vulnerable populations that use intravenous drugs. So they must be protected from both. So there has to be alternative solutions created to kind of minimize the risk of both simultaneously, however hard it might be.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.